talking about skincare today because it can break any woman's budget when she walks through those aisles and picks up those creams and cleansers. Now we know we got to cleanse, tone, and moisturize. But even the best cleanser and the best moisturizer will not work if your skin has been damaged by the sun. And we've all been hearing about it, that sun is bad for your skin. I don't understand that. It's a natural product, but we have somebody here today who's going to help us understand it. Many of us are still going out there tanning. See, I don't have to do that, doctor. I guess you can see that. But he's here anyway to talk to us because it's a real issue for many people. This is Dr. Bruce Katz, and he's going to show us exactly why you must always wear a sunscreen, especially on your face, because we've learned from Carolyn that our skin is very delicate, right, on our face. So you brought along your little friend over there. That's your UV machine?
Yes, this is actually a UV camera. And this can tell us how much sun damage you have deeper down in the skin.
Really?
Often you can't tell just by looking at your skin without this UV camera. And what we do is take a photograph normally, and then we take a photograph with this UV lens, we push it down, and this allows us to see the deeper damage.
The deeper damage to your face or your skin?
To your skin that the sun has caused.
Now you've done some of this. You have some models,
yes,
and you have some things that you're going to show us. I want to see them, okay? So first we did a very young woman, right?
That's correct. And on this young lady here, that's the normal photo. That's what you just see when you look at her face.
And here she is. She's looking gorgeous, looking lovely, darling.
Absolutely. And if you see with the UV filter, you can see just a few little dark spots on her cheeks or chin, just about around the mouth. And she has a mild amount of sun damage, not very much.
Really? Have you, Allison, have you been sunning a lot, tanning a lot?
Not really.
No? This is just walking in the street?
Right. And a lot of people don't realize, just by walking around without sunscreen, it's cumulative. Over the years, you get sun damage, even though you may not sit and bake in the sun.
Okay. Then we have another woman, somebody who just came back. You just came back from Aruba, right?
Aruba, yes, I did.
Okay. So now let's take a look at your photos and see. Now
that's
this is what
she
looks like.
Exactly.
Okay.
And with the UV filter, you can see that there's a lot more damage there. A lot of those dark spots, we call that pigment clumping. And pigment clumping means that you have sun damage. And that's deeper than you can actually see superficially.
Wow.
Shocking.
Is that shocking for you, Nancy?
Yeah, it's very shocking.
Yeah.
I, kept my fingers crossed thinking maybe, it wouldn't be as bad as I imagined it to be. And then when I saw the before and after, I was pretty taken aback.
So do you wear a sunscreen when you go tanning or when you're in the sun?
I do put on somewhat of a sunscreen. I put on 15 SPF and
15 SPF.
Right.
SPF means sun protection factor.
Okay.
And everyone should wear at least an SPF 15. But today it's actually more important what's in the sunscreen, not just the SPF anymore. So you should really look for either or any of these three items: Parsol, zinc oxide, or titanium dioxide.
Oh, my Lord.
Any of those
Carolyn
three
just
are
told us
critical.
don't put things on our skin that we can't say. Now,
Well, these are actually natural products.
Oh, they are?
They are natural products.
They couldn't have names like parsley or garlic.
But this gives you the best protection.
Okay.
It's actually better with an SPF 15 with these products than an SPF 50 without them.
Okay.
So that's really important.
Now we're going to look at Debbie. Now Debbie is our more wise woman, our more mature woman. She has more mature skin, and this is what she looks like.
That's a regular photo.
Okay, now.
Now, when you look at the UV photo, Debbie spent a lot of time in the sun, and you can see all those dark spots. That really...
Take a breath, Debbie. It's all right. It's okay. Come on, honey. We're going to get you over to the table with Carolyn. Put some oatmeal or carrot juice on you. It'll be all right. It's okay.
But she has rather severe sun damage.
And look at her face. It is exquisite.
Thank you. I was really surprised because I would say for the past, I don't know, more than 10 years, I have been so careful using special face sunscreens with an SPF greater than 35, wearing a hat, but I guess from years ago when there, really weren't so many sunscreens available, I wasn't as careful.
Is it possible that people have more delicate skin than others? Is that possible?
Yes.
Yeah.
In fact, lighter skin, fairer skin is more delicate in terms of sun damage than darker skin.
Okay, so now if you put the camera on me, what would show up?
We probably wouldn't see very much.
Alrighty
Because
then,
you probably
I
don't
have no
too
damage.
much. Well, probably a little bit, none at all.
Really?
Yeah, everyone has a little bit, unless you haven't been outdoors since you were 2 years old.
So what is the result of the damage? Because poor Debbie here, you know, what is she going to do with her face? What happens? She's damaged, and now what?
Well, the good news is that we can actually take care of it. We can do chemical peels, we can do laser treatments today that will remove more than 80 to 90% of the sun damage. So,
Chemical peels?
Chemical peels that will
Okay.
work very well. Laser treatments will take away sun damage and help prevent skin cancer from developing in the future. So that's important.
Why did you say that? Is that a possibility with damaged skin like that?
Absolutely.
Really?
That's the significant part about it.
But let me ask you something. When I was little, my grandma said, go outside in the sun, it's good for you. So is there safe sun? Is there good sun, a bad sun?
Well, a lot of our parents and grandparents used to tell us that, and years ago it was thought to be very good for the skin, but we know now that sun causes skin cancer, and there's no question about it. But for a lot of people, more importantly, it causes premature aging and wrinkles. So we try to convince our patients that if you're not going to protect yourself against the possibility of skin cancer, at least stop sunning so you don't get prematurely aged and wrinkled.
But the sun is out in the winter. Are you supposed to walk around in the winter in a sunscreen?
Well, that's very important too. In fact, if you're going to be outdoors a lot, particularly if you ski and you're out in the snow where sun reflects off the snow, you should wear sunscreen too.
In the winter?
In the winter time.
Get out
Absolutely.
of town.
Yes.
You sometimes can't even find it in the winter.
Well, at our center, we always have sunscreen year-round.
Okay. Okay, we're going to talk more to you about some other interesting things. When we come back, Dr. Katz will show us how to get rid of the one thing that can strike fear in every woman's heart. Cellulite. Don't you want to know what really works and what doesn't? Find out when we come back.